coracoacromial arch. This coracoacromial arch, it is also called as the suprahumeral arch. This coracoacromial arch also called as the suprahumeral arch. Suprahumeral arch. So suppose if we take this is a scapula. Okay, this is a posterior view of the scapula. This is our scapula. Okay, so here we'll be having the head of the humerus. This is the spine of the scapula. Spine of the scapula. This is acromial process of the scapula. This is posterior view. Suppose if we see anterior view, this is our glenoid cavity, so that here head of the humerus will be there. So here scapula will be having one process, that is the coracoid process. This is the coracoid process. Posterior acromial which is present here, it will come here, that is acromial process. So in these two cases, we'll see that point, then we'll see the coracoacromial arch. It is coming from the coracoid process of the scapula to the acromial. Coracoid process of the scapula to the acromial process. Between these two areas, this ligament will be there. This is the coracoacromial ligament. The arch, what we are saying here, we will come to that point. This is the coracoacromial ligament. It is coming from the coracoid process to the acromial. So that here, why we will call it as suprahumeral arch means, this is, see here, if you observe here, this is coracoid, this is acromial. So between these two areas, mean the ligament will come, so that it is superior to the humerus bone. So that's why it is the suprahumeral arch. Now we'll see this coracoacromial arch. This coracoacromial arch is the suprahumeral arch. Okay, suprahumeral arch. It is going to make this ligament will be having osteoligamentous vault. So here the head of the humerus, usually if the head of the humerus is here, this is the lateral view, what we are saying, lateral view of the scapula. So if we see humerus here, the humerus which is present in the superior portion of the humerus will place here, so that we discussed in introduction classes. This is also a fifth joint in the shoulder complex. It is also a functional joint. It is not a anatomical or true joint. So that here the head of the humerus superior portion will be placed over the osteoligamentous vault of the coracoacromial ligament. So while keeping here, in this position, it is the ligament is going to create an arch. So that's why it is a coracoacromial arch. Now behind this, so see here coracoid process is there, here acromial is there. So between these two, here we are having the ligament, and now we are having the humerus bone. So here one space is there. Inside that space, some special structures will pass. Those are the supraspinatus tendon will pass, and biceps brachii muscle tendon will pass. At the same time, subacromial bursa will pass. So bursa, these are the structures which will pass beneath, which will be inside this arch. Now we'll see function of this arch. The arch which is present here, it is going to protect the structures which are present inside the arch. Towards the inside the arch. So that means it is going to give protection. Okay, suppose if some upward force comes, so like carrying weight, suppose we are carrying weight on our shoulder, that full weight will come here, so that the presence of this ligament, it is not going to compress the structures which are present inside this arch. So that's what it is going to provide the protection. And at the same time, here one negative point is there. The way how the coracoacromial ligament is protecting the structures which are passing inside, in same way, if the ligament is going to compress, that time the ligament itself, it will give compression forces. It will give compression forces to the subacromial bursa. At the same time, supraspinatus tendon. If it give compression to the subacromial bursa, that is nothing but the clinical condition like disease. It is called as the subacromial bursitis. It is going to give inflammation to the bursa, and supraspinatus tendon, it may go for impingement. At the same time, maybe inflammation. Sometimes in chronic cases, tear also. So these are the points about the coracoacromial ligament or arch. It is also called as the suprahumeral arch. It is going to give protection to these structures. At the same time, the same itself, it may compress the structures which are passing beneath this. Clear?